Good morning. It's 11 a.m. We'll be returning from recess from our morning BOCC session for the purpose of receiving a public health update as the Board of Health. Amanda, could you call the roll, please?
Commissioner Richardson?
Here.
Commissioner Thayer?
Here.
Commissioner Pettit?
Here.
All righty, ladies, we'll put you in.
I'll make a motion. We open the public health meeting.
Okay, we have
Second.
a motion and a second to open the public health meeting. Board of Health, all in favor, please say aye.
Aye.
Aye. Aye. Motion carries.
Community. Just wanted to let everyone know that our director, Dwayne Smith, will not be in attendance today. So we are doing a team effort in presenting. My name is Lisa Helseth, and I am with Elbert County Public Health. I am the health educator. Also with me today is Sarah McIntosh, and she is our health nurse. And she will also be presenting today on COVID updates, vital record updates, and then some opportunities that we have coming here in the future. And then we have Stacy Reinhardt here with us to talk about the on-site water, sorry, I lost my place. On-site water treatment systems and food licensing reports. So what we're looking at here right now is just the fundamental capabilities on the top of the health department, and then below is our services that we can provide. So we are still meeting and interviewing our list of informants and anticipate completion of this mid-May for our community health assessment. The survey creation was finalized, I think it was on Monday of this week, and we're getting ready to deploy that out into the community. We're hoping by Thursday of next week. The following slides just show our secondary data review findings, providing some insight into what is currently known about the state of our community health and our county residents. A full report will be published with the community health assessment findings in late June or early July. Our source range comes from Colorado Hospital Association data, the Colorado Health Information Data Set site, which is COHID on CDPHE, Healthy Kids Colorado survey, and then we have some state data from Human Services as well. So right now we're seeing that the poverty rate in Elbert County is 4.8% compared to Colorado, which is 9%. The TANF is 1.5 for Elbert County, and then Colorado is at a 3.5. So we hope to increase the services for WIC here soon with this assessment that we're doing, and hopefully reach some more families. Currently we're only at 9.5% for kids under age 5 that are enrolled in WIC. And then here you can see students receiving free or reduced breakfasts, residents that have health care coverage, which is at 89.7%. And then prior to the COVID pandemic, we were showing only 86% of the residents visited a healthcare facility versus Colorado at 87%. So access to primary care in the county is not as robust as our surrounding counties, and it's our assumption that many residents have a primary care physician outside of the service area here. What we are seeing is Elbert County, there's roughly 6,570 residents per PCP versus Colorado shows 1,210. So.
you don't have to stay in your county to get health care, so.
Oh.
Are there other things, other sources that just kind of show catchment areas, or? I mean,
You know, and-
none of us, I mean, it's easier to get, it's a shorter drive to Castle Rock where there are
Right.
providers than there is
Right.
to
I think,
Lyman from here, so why is it so important? I mean, it would be not, I mean, we would like to have
well, and I think,
services within the county, but it's not.
yep. Well, and I think it'll
Like
help
we-
us,
Nobody has access to a doctor when
right?
to drive.
Exactly, and I think it helps show that we are lacking services a little bit, and that way we can actually rally and maybe get a provider here, you know, like a doc in the box, a little more, and we're making progress, it just seems to be a little slow. It was collected earlier this year, or actually, I think it was 2021 data. And then, so I'm going to go through these slides pretty fast because it's just breaking it down. So access to dental care, again, 13,360 residents per dentist versus what the Colorado figure is, which is 1,220. We're showing that 62% of our residents saw a dentist in 2021, which is a decrease from the pre-pandemic rate of 70%. And does that mean that the dentist has to be in the county, or so that would have been dentists anywhere. It was just the actual visit that they made. And so we are showing that fewer dentists in Elbert County compared to there are fewer dentists in Elbert County compared to the rest of the state, but I see that increasing. I see a lot of new services available in Elizabeth and surrounding areas. Okay, so this is just going over our cancer rates. According to this slide, it says that our cancer rates are lower in the county, which I agree with. However, the numbers that we're looking at, it shows that leukemia is higher in Elbert County, and death from lung cancer as well. And then here we are looking at heart disease and chronic illness. Again, 25% of the residents have high blood pressure versus 26% across Colorado, so we're a little lower there. 50% of our residents with high blood pressure takes medication for it versus the 68% for Colorado. Our death rate for cardiovascular death is 190 per 100,000 residents, whereas it's 170 for Colorado across the board.
Just saying, I mean, I think our average age is about 10 years older than the state. Does that skew the chronic disease? A little higher, or?
You know, I don't know that they went off of age group here. That's something I could certainly ask. Right. Okay, so this is on kidney disease, and similar rates. Colorado's at 1.8% and Elbert County is at 2.2%. And then the death rate is much higher among our county residents at 20 deaths per 100,000 versus Colorado at 7.5. Asthma and COPD, you can see the numbers here. It looks like we're kind of right on with what's happening in Colorado. The hospitalizations are definitely lower. And then we're we're showing that the Elbert County has 11.3 visits per 100,000 versus Colorado at 23.4. And then we talk about obesity and diabetes here. Similar rates, 25% of the county and state residents classified as obese, which is basically what we're seeing across the board for Colorado as well. And then chronic disease and illness with Alzheimer's is 26 deaths per 100,000. And we have 35.6 deaths per 100,000 for Colorado overall. As far as substance abuse goes, it does appear that drinking is a little bit higher in Elbert County. Could be because we're so isolated at times, and we hear a lot about different issues going on with ranchers or farmers that are isolated and have a larger drinking issue than, anyway. Marijuana use, looks like we are down a little bit from what Colorado, which is good to hear. And then we have opioid overdose. Within the county is 23.3 per 100,000 compared to the 38 in Colorado. Hospital admissions are definitely lower as well. And then the overdose deaths are very low compared to what we have in Colorado. All drugs in general, as far as emergency department visits go, we are lower at 149.6 per 100,000. Hospital admissions for opioid overdose for Elbert County is 56.1 versus the 80.8. And then deaths in the county are 12.7 versus 19.2 in Colorado. And then with STIs, we are definitely very low. Less than 1% of the population is living with HIV. Mental health. According to our Access survey, Elbert County residents report less mental health distress than Colorado residents as a whole. However, they do say that there was 8 days or more of poor mental health in the last previous 30 days. And this was reported after, pre-COVID was only 18%. And then with COVID happening and where we are currently, it's 24% of needing some assistance. And then we have more mental health information. Colorado in general, 85% of residents reporting having good mental health. And then we're showing Elbert County at 92%, so we're higher there. It's all about being outside, being able to have some outdoor life. And then in 2021, the rate increased to 12%, and that is over the past 3 years, that mental health or substance use needing a professional for treatment. So Elbert County, there were 950 residents per mental health professional versus Colorado with the figure of 270. While more Elbert County residents have been seeking out mental health supports, fewer health professionals related to or relative to resident means the residents must travel further for access to care. Deaths by suicide. In recent years, the suicide rate has really spiked in Elbert County. We're showing 47.6 deaths per 100,000 versus the Colorado at 22.3. Suicide across the state varies across all age groups, where Elbert County suicides in 2020 were isolated to 35 to 54-year-olds. And the suicide rate in Elbert County tripled from previous years, with 40% of suicides completed by firearm. More secondary data reviews for death from preventable injuries. I won't go through them all, but we can highlight that, again, firearms is a lot higher than what it is in the state at 27.9 deaths per 100,000 versus 15.5 deaths per 100,000. Again, ED visits due to preventable injuries. You can look at the information here on the slide. Again, we're saying the absence of a hospital likely contributes to the lower rate of visits to emergency department for Elbert County and may also contribute to the higher rates of death from injury. And these are the current data gaps we are seeing right now. We know that there were school districts in the county that did not distribute or complete the Healthy Kids Colorado survey. Access to care, I think we're still trying to work on that. We've had a couple of discussions with surrounding hospitals to talk about that a little bit. And how, homelessness and housing instability is just really not something that we see here in Elbert County much. If we do have homeless folks come in, they don't stay very long. And we're just not seeing much data there. Okay, I'm gonna go ahead and let Sarah McIntosh take over and talk about COVID and give us some updates.
Good morning, everybody. As Lisa said, my name's Sarah McIntosh, and I'm going to take over from here with a quick update on COVID and then a little bit more information on what our plans are as far as the public health department goes. So these are the Elbert County confirmed cases and the trends that we're seeing as far as COVID goes for right now. We are seeing a very, very slight increase related to the new Omicron subvariant B2.12.1. However, at this point, there's no changes to our plan to continue to off-ramp for COVID. We are still trying to stay prepared to ramp back up if we need to, but we are optimistic. Hopefully this will start to trend down. There were some studies we saw this morning from our latest update that this Omicron subvariant that's trended across the East Coast is starting to trend back down about now, and we're about 2 weeks behind them. So hopefully we won't see the big peak that we saw with the previous variant. So here are the public health department's testing numbers for COVID testing from January through March this year. In April, we did cancel our PCR testing just because our testing numbers turned down to like 1 or 2 tests a week. So we didn't feel like it was worthwhile to have that testing company come out here and continue to offer testing if nobody was taking advantage of it. So that 237 is just through March. We did do an additional 19 tests in the month of April and 14 tests at the jail between the health department and the jail since then. So I am continuing to offer the rapid antigen testing at the public health department for anybody that needs testing for travel, anything like that. Monday through Thursday, 8 to 10 in the morning, and 2 to 4 walk-ins are welcome. And I can give test results for anybody, like I said, that needs documentation for travel. And I also am distributing home test kits for anybody that might need them as well, so that you can have them if you need them at home. I do ask that people coming in, if they are sick, call me when they get there, and I will bring them out to them. If they're collecting them at home for use at a later date, they are welcome to come in and we can give them some test kits for home use. So here is our rate of vaccinated residents in the county, and I'm expecting we're going to stay pretty close to where those numbers are right now. Because of the decrease in demand for this as well, our vaccine bus has stopped making routine trips out to Walmart, but we are looking at getting our vaccine program built back up at the public health department. It is probably going to take a little while as we get through some of the hurdles and get through the logistical stuff as far as Medicaid and insurances go, but we're hoping to be up and running and have a program running by fall so that we can include flu vaccines as well as our childhood vaccines and standard vaccinations also. This is a good time. I also want to remind the county residents as well that as I'm going through all of our old records, anybody that received vaccinations at the Elbert Elbert County Public Health Department, I have probably 3,000 old records that are in decaying condition and need to be shipped out and uploaded to SIS. I know a lot of people have very strong opinions about that, and I am completely willing to help anybody out. So if you are in this boat, please contact me at the Public Health Department before the 1st of May so I can pull your records so they don't get uploaded, and I can get you a copy so that you have copies of those to retain. It's an opt-out process, and for people that don't want their information in the system at all, I'd prefer to pull it now while I have the records in my hand, get that information to you guys so that you can take responsibility for it before I ship them out. If you get this information later than the 1st, please contact me and I can help you through the process once they go out as well. So I do want to respect people's wishes, but unfortunately the records I have will be lost and misplaced if we don't do something with them. Okay, that brings me on to the next plan. As Lisa was talking about our community assessments that are going out here in the next couple weeks, I am going to be looking to those very attentively to see what the community feels like its needs are right now. Because I'd like to start to plan to build our clinic and our laboratory services at the Public Health Department up a little bit as well. When we were looking at the numbers earlier that showed the ratios our physicians in the county have to the patients that we can see, I'd like to give some people some more resources where they're not having to make a 2-hour drive to get some tests going. So my first plans I'm looking at is a piece of equipment that will give me the opportunity, yes, to take over PCR testing if COVID ramps back up for COVID, but we'll also do PCR testing for flu A and flu B, as well as RSV and strep. And then there is a module that I expect to come out with this platform in about the next year that can also do STD analysis as well on urine. So in addition to that, I would like to build up more testing later on, whether it's me drawing blood and sending it out to a lab that I'm collaborating it with, or me getting equipment to run it here where I can do basic lab studies as well, like blood counts, electrolyte panels, kidney function studies, diabetes studies for anybody that needs it, as well as coagulation studies for anybody that's anticoagulated, just to help get that barrier so people aren't making a 2-hour round trip for blood work. We also have entertained partnering with a nurse practitioner for some hours, a couple hours during the week, that we can offer some clinic visits from an advanced practice nurse as well. Any questions? And then we're on to Stacy.
How do you forward this?
The right arrow.
This one here?
Yep.
Okay. I'm Stacy with Elbert County Health Department, and I oversee our environmental services such as on-site wastewater treatment, as well as restaurants. So basically, real overview is that we had septic revenue at $35,000 plus, and food license revenue is currently at $11,000. Let's see, we'll kind of go through a little bit of the breakdown. So kind of in a nutshell, what we can see here is that for 2021, we really did increase quite significantly. Of course, in 2022, we're only looking at a first quarter, so and we get a little bit more into breakdown, but a lot of growth was happening last year, and we are still continuing in that direction. These are different types of permits that we issue, new, use, and repair. Across the board, those were all pretty significantly increasing in 2021, as well as a lot of permit increase in use permits. That jump is I guess I would say, as far as use permits go, is not only just for the sale of homes, but use permits encompass a pretty good size portion of permits relating to additions of home, ADUs, new bedrooms going into the home. They have to go through that use permit process to make sure that the size of the system is going to be significant enough to be able to accommodate addition, as well as that it's in good working order. That has been a really useful program that we've been, I would say, over the last 2 years, this would be going into the second year, that we've really been targeting to make sure that we develop that, because we do have a lot of older homes out in the area, and so it's a good way for us to be able to know that the systems are working as they should be.
For system replacements, are those under repair or new?
Yeah, so under repair would be, and that kind of encompasses a lot. So it could be just a new tank, it could be a new field, it could be both, or it could even be a line alteration, meaning that it needs to be, the line is no longer watertight or has a belly or something like that. So some sort of a repair. There are some repairs that don't require permits, and I guess the basic way to break that down is that if it's requiring that there be excavation in the process to really dig something up and repair something, then that's going to require a permit as well as an inspection to make sure that that's being done correctly. So yeah, basically we're still seeing growth, and we had quite a few new builds in 2020, so I think we're still trending in a pretty good direction for growth. This is just kind of another graph that reiterates for people who are a little more visual what we just went over. Inspections, as you can see, a pretty significant jump. And again, a lot of that is new build. They might have started in 2021, but now it's kind of cycling through, so into the 2022 year, as well as those use permits that we just talked about that more often than not would have a repair permit attached to that, getting out there and doing a lot of those inspections as well. And that's kind of, again, just a breakdown to kind of show you where we're at for the month of April in comparison to other months for that time. Okay, moving into food licenses. It's a little bit tricky because it's divided up by quarter, so we don't really get a breakdown as clearly as a kind of a per month as much. So a lot of our mobile units don't renew licensing until April. We kind of give them a little bit of grace period because they don't actually start really doing a lot of special events until into the year. So as long as they're not operating, then that food license isn't necessary to have on site until they're ready to start their operations. And for, again, like I said, most mobile units, that's going to be coming months into April, so we give them until April 30th. The rest of your food retail establishments, such as your grocers, schools obviously, and then of course your restaurants, they operate year round, so they need to get those in by January. Let's see. So you're going to see kind of that, it looks like it's a little lower. Also, what I will say is that we received the final disbursement for last year's cost for the restaurants that we covered, or that the state covered, which was $2,387.75. So all of that went according to plan, and we did get all 4 reimbursements from the state for that. Okay, and then I think that's about it for me. So thank you.
One more, just a quick update since we stood up our vital records issuance again. We were deferring to Castle Rock and Tri-County to print our vital records for 2021, so that's why those are at 0. And we were able to resume services on 1/24/22. As you can see, we've printed 22 birth certificates and 3 death certificates since we opened. And so if you follow with what our previous numbers are, right now we have generated $465 since we started and are well on track to surpass what we did in 2019. The last year we had a full year of printing certificates. So I think that's it.
Thanks. Actually, I have a couple of questions for Lisa.
Okay.
Back on the data, and thank you, ladies. Just the couple that kind of jumped out to me. We're really focused on opioid addiction and overdoses, but we had 5 times as many overdose deaths from things other than opioids. Do we know if there's something specific, or those are random drug overdoses, or?
I
And
don't
that was only
know.
2 out of 12 per 100,000.
Right.
If there's something else we need to be looking at in the county other than, in addition to opioid.
I do not know. I can take a closer look at the data. We compiled this as a team.
You know,
so-
I get that. I'm not trying to, looking, yeah, more questions, than
But
looking for answers.
absolutely,
And
and
then the other was the kidney disease death was so much higher than the state. Is that access to dialysis, or it just seems a little, I mean, I know we're small numbers and they magnify, but that one seemed like,
well, and you know, a lot of that I think would be a lot of people skip their annual checkups, not paying attention. You can have kidney disease from taking a certain medication and not following up and seeing even like liver enzymes change, you know, with medication. So it could be something like that. I don't really know until we take a deeper dive. But I can certainly circle back and let you know if we do find something.
okay. And then the 2 others, more people accessing mental health providers, is that, and again, I don't think the answer is here in the room, but just whether that's more mental health issues or more people becoming comfortable looking for help. And
You know, I kind of think both. The younger generation sees that as a benefit. I mean, not as a deterrent and saying, well, I can't do something. It's like, I need to talk to someone. Whereas I think older generation like myself, we feel very proud sometimes and don't want to seek that help. So it just varies again. We have heard that Elbert County School District had reported that there were 4 cases of school-age children being hospitalized, and it was about anxiety and issues they were having there. So our services are a little limited. I think Centennial Health is the only one here that we can physically go see someone. Telehealth has become a lot more popular, I think, since COVID. And so I think people are seeking services that way, and they're comfortable. It varies. I think it depends on the person and their technology ability. But I feel like the younger generation really accepts that and does well with it.
okay. And then I guess the other, just the, or the last one I'll hitch up on was just the deaths due to injury. I mean, a lot of the farm accidents can be horrendous, and I'm not sure if comparing to folks to the east of us.
I'll kind of talk to that a little bit, and I think part of it is what Dwayne hit on as far as injuries and accidents out here, is we are so far away from emergency medical treatment that you need, I mean, to get someone to the hospital is tough, because a lot of times if you have minutes, it's still a very, very challenging situation to save someone in a hospital situation. So. And they are wonderful, and but they can only do so much until you get someone to a hospital. So if you have someone who has really severe injuries, they can bleed out before they hit a point where they can get help. And that it's just a timing thing, unfortunately. Yep. Go ahead. Oh, yes. We are nearing the end of that. So I have a pretty robust TB program in place now so that we can step it up again if we need to. But yes, you got it. So at this point, that TB has been something that has plagued the United States for a long time. And in the 80s and 90s, we were doing skin tests on almost everybody at any physical they went to, just because the numbers were so high. So they are down very considerably in the United States as a whole, just because of the treatments and how closely it's monitored. But it is something that we still treat seriously so we don't hit that point again, just because it is contagious and it can spread quickly. So, okay? Any other questions for me? Okay. Sounds good. Thank you.
So with that, I'd accept a motion to close the Board of Health.
So moved.
Yeah, I'll second.
Okay, a motion and a second to close the Board of Health. All in favor, please say aye.
Aye.
Aye. Motion carries, and we are in, it's 11:35. We're in recess till 1. We'll reconvene here to hear land use items.